Hello friends, welcome to my YouTube channel Anaesthesia Talks For All. Today I am going to talk about IGEL, its use and its technique to insert. First of all, I will show you a video of IGEL insertion technique. Then I will talk about it later. So this is a video. This patient is posted for laparoscopic cholecystectomy. I'm getting it done under IGEL. First I am doing bag and mask ventilation. You can see the mask and it's connected with the circuit of the machine workstation. After doing bag and mask ventilation for 3 minutes, now this is the IGEL. You can see the size also mentioned on the IGEL. First we will apply jelly. Now after slight mouth opening, we will insert the IGEL. You can see in the video. After properly inserting and ensuring its proper position, then we will connect this IGEL with the ventilator circuit. So this is the proper technique of inserting an IGEL. Now coming on to the pictorial representation of IGEL insertion, you can see in these pictures, the black arrow is the direction of the IGEL, and it has two openings. One is gastric opening and the other one is tracheal opening. So it automatically fits in that way that the main opening of the IGEL is guided into the tracheal opening and the gastric outlet is going into the esophagus. So this is the proper insertion technique. This is another picture which clearly depicts the position of IGEL from the lateral side. You can see that the opening of the IGEL is directly in contact with the mouth of the opening of the trachea, and the tip of the IGEL goes into the esophagus, through which we can pass the Ryle's tube. Now coming on to the parts, I will tell you on brief parts of the IGEL. First of all, you can see the number of the IGEL. We will discuss about the size and number of the IGEL later. There is a 15 mm connector which is connected to the breathing circuit or ventilator circuit. Then there is a proximal and gastric channel, which is for, you can put suction catheter or you can put Ryle's tube through that. That is that opens at the tip of the IGEL. Another one is the integral bite block. Like its position comes between the teeth. So the patient, if comes out of anesthesia or its patient is light, then the patient doesn't bite the IGEL. So integral bite block is there. After that, there is a buccal cavity stabilizer. This stabilizer prevents the IGEL to rotate inside the mouth. Another important thing is epiglottic rest. This epiglottic rest prevents the epiglottis to bend or come in between the airway. And most important thing of this IGEL, which differentiates it from the another LMAs, is that it has soft non-inflatable cuff. Like in other LMAs you have seen, we have to inflate the cuff with the 20 ml or 30 ml syringe depending on the size. It has self-made already according to the position of the IGEL. It is already designed, so it is non-inflatable cuff. And as I already told you, the distal end of the IGEL is gastric channel, through which we can pass through the Ryle's tube, which directly goes into the esophagus. This is another picture of the parts of the IGEL. I have already explained to you. Now, coming on to the sizes of the IGEL, there are different sizes. You can see like size number 5, 4, 3, 2.5, 2, 1.5 and 1. So it is according to the weight. You can see mostly if we use in adults like 50 to 90 kg. So I usually prefer size number 4, the green one for 50 to 90 kg. And if the weight is less 30 to 60 kg, then we can use 3. And even it is available for pediatric age group. For obese patients who have higher weight like above 90 kg, we can use size number 5. The size number and the weight for which it is being built, it is written on the IGEL. Coming on to the differences between IGEL and endotracheal intubation. Endotracheal intubation, in which we intubate the patient with an endotracheal tube and then we inflate the cuff of the endotracheal tube. So naturally it prevents aspiration. It is short airway and it can be used for long surgeries. But if the surgery is less, duration is less, time duration is less for the surgery, then we can use iGel in place of endotracheal tube, because it prevents the tracheal irritation which a endotracheal tube can cause. It automatically fits in the laryngeal area, so it is very easy to insert. So friends, hope you have liked my video. If you have any doubts or queries, kindly write in the comment section. I will definitely try to answer them. Kindly share, subscribe and like my channel. Thank you.